Well, Cindy Blackstock has been tracking the plight of Aboriginal children in care. She is the executive director of the First Nations Child and Family Caring Society of Canada. She says the agencies caring for Aboriginal children collectively have 22% less money to spend on them than those agencies caring for non-Aboriginal children. Her society has taken the matter to the Federal Human Rights Commission. Cindy Blackstock is in Clear Lake, California, near San Francisco today. Good morning.
Good morning.
Why are there so many Aboriginal children in government care compared to non-Aboriginal children?
Well, what we do know is actually Aboriginal children are less likely to be reported to child welfare for abuse. So it's not abuse driving this, it's neglect.
Physical abuse you're talking about, huh?
Right.
Okay.
Physical abuse, emotional abuse, or sexual abuse.
Okay.
It's neglect driven by poverty, poor housing, and caregiver substance misuse that can be linked back to residential schools. Now, the good news is all of those things are solvable. The bad news is, as you pointed out, is that the federal government that funds child welfare on reserve, because the province is funded off reserve, the federal government provides less funds for services so that we can get at those problems. Because this really is, in my view, something that we could solve for these kids.
And so your children are put in care ostensibly to help them. What is this doing to those children that you see?
Well, we're already seeing through the work of Janine Carrier and others a multi-generational effect of child welfare. Those kids are getting the same kind of cultural dislocation that we saw in residential schools. The parenting issues start to dissolve because many of these kids are not just in one foster home, they're in numerous foster homes transferring around. So they don't get that same level of nurturance that, in terms of their parenting skills, that other children receive.
Well, I'd like you to hear a clip and get your view of this. This is Sade Scott. She was 6 when she was placed in care with her great aunt and uncle. She says they gave her a loving home, but she was still dogged by the system. Listen to her.
It sucked having social workers and stuff, right? Because it limited a lot of the stuff that I could do. Because policy and procedure, right? Just to go on out trips or go on sleepovers or, do normal stuff that normal young people do. I wasn't able to do that. And a lot of, the social workers, they never came to see me. There was times where I didn't even know I had it, who my social worker was. I mean, must have had at least, 50 different social workers. I had this one worker, and then I had a toothache. I guess I went to the dentist, and they said that I wasn't covered, so I need to go to my social worker and get that approved. So I found my social worker, and I was in excruciating pain. And maybe I was a little impatient as well, especially I was 17, right? And then my social worker said, I don't have time for this. There's more important stuff. And she hung up on me.
Okay, so that is Sade Scott. She's 22 now. She's the Child and Youth Coordinator for the Federation of Aboriginal Foster Parents. Cindy Blackstock, she was raised by extended family in a what she considers to be a good and stable environment, but she says the system still made it tough for her. What do you think?
The state is just a lousy parent in general. Social workers are so overwhelmed, and they do have to follow these very rigid restrictions that normal parents don't have to follow. And it does get in the way of a normal kind of child development and growing up period for many children, even in the most optimal of circumstances. What we know is that children in care are less likely to graduate from high school, more likely to end up in the incarceration system, more likely to have mental health issues. It's not that we pull children from dysfunctional families and we put them in these wonderful utopic environments where they grow up to be really well. It's really a trade-off when you do a removal from a family, from the risk in the family to the risk of growing up in care. And too often that's not weighed out by social workers. We take the judgment of the moment. We think there's got to be something better for this child. And it's not until you do child protection for many years that you see these kids growing up in care, moving, often as many as 10 to 20 times in different foster homes, that you understand that where we're putting them is not an ideal place.
So what's being done to try to keep more Aboriginal children with their parents rather than remove them?
Well, that's one of the key things for this Canadian Human Rights Tribunal against the Government of Canada. It's crazy that we have to file this, especially, in light of the billions of dollars they're spending on the G8 and on the fake lake in Toronto. What we had done over the previous 10 years is worked with the federal government on 3 different solutions to address this. The Auditor General herself confirmed the inequality, but the federal government walked away from the table. And what we were asking for are services to keep kids safely in their families, addressing those factors we talked about: poverty, poor housing, and caregiver substance misuse. Had that been done, we would be on the way to being able to reverse this crisis. But instead of dealing with the problem, the federal government, I guess concerned about the overwhelming amount of evidence against them, is trying to get off this case on a legal loophole. And they lost twice in federal court, but that didn't stop them from filing the same motion at the tribunal, trying to get away from a full hearing in front of the public on the merits, which is what we want and what we think these kids deserve.
Now,
so we had a hearing on that, and we're waiting for the ruling.
Okay. And do you have any idea when it'll be?
We don't. Probably over the summer. We're hoping that the chair of the Canadian Human Rights Tribunal comes back very quickly on this, because we're talking about very vulnerable kids.